We have a couple of really exciting trials open at Fox Chase right now, and they're open. We don't have results from them, but we have really good science to sort of back up the strategy that we're doing, and I'll talk about 3 of them. The first one is a treatment allocation study for people with muscle-invasive localized bladder cancer. These are patients who would normally get neoadjuvant chemotherapy followed by surgery to remove their bladder. We think that by using a combination approach of imaging, cystoscopic evaluation of the inside of the bladder, and genomics on the tumor, we can predict which patients are going to achieve a complete response to this neoadjuvant chemotherapy. And then as per this trial, those patients are allowed to keep their bladder in place and go on to surveillance. And we're hoping that with this approach, we'll be able to spare a subgroup of patients, we think hopefully 20 to 30% of patients, from cystectomy so that they can live with their bladders intact. So that one is open and accruing briskly. We're going to be opening it at a couple other centers in the US as well. That's one we're very excited about. We have another trial in kidney cancer looking at the combination of Nivolumab with Axitinib. So another VEGF PD-1 combination. Axitinib we think combines very well. It's combined safely with Nivolumab. It's combined safely with pembrolizumab, as we just discussed. We're looking at it in combination with Nivolumab, and that study, once we prove safety, which should be complete in a few months, then we'll expand to a frontline and a second-line cohort. And that will be open in New York, in Baltimore, and at Fox Chase in Philadelphia shortly. So we're very excited about that. And the third study I'll talk about is also a bladder study. And this is a study looking to see if we can take those patients refractory to PD-1 inhibition and make them sensitive to PD-1 inhibition. And the science behind this is very well developed and very robust, but our approach is to take patients who've progressed on a checkpoint inhibitor, pembrolizumab or atezolizumab for instance, and then give them atezolizumab, but add a drug called Guadecitabine, which is a hypomethylating agent. There's very good data that this hypomethylating agent increases expression of antigen, improves antigen presentation, and overall uses this viral mimicry mechanism to create a very immune-sensitive microenvironment in the tumor. So that's funded. We were very excited by a Stand Up to Cancer Genentech Catalyst Award through the AACR. And so we're excited to have that up and running and enrolling.